I did 4 rounds of Xifaxan to try to treat my hydrogen SIBO. After the first 2 rounds, my symptoms of bloating and gas got better. After the 3rd and especially 4th round, my symptoms got much worse.
Mm.
Testing-wise, after the 3rd round, my results were much worse. After the 4th round, I tested negative. So wondering what this all means. When I test negative, my symptoms actually got worse.
Sometimes I think it might be a matter of what happened just before the test. Might not apply to this person, but I just want to mention this. Sometimes, I don't know if it sounds like this person just had hydrogen. So, but sometimes there'll be like a clean out bowel movement event that occurs too close to them before when we're going to take the test, and the test will be negative, even though, because I think the bacteria kind of got cleaned out, even if we're still bloating and having symptoms. Sometimes I think things like that happen. If that didn't happen, then it's a mystery. We have a couple of options to think here. Could it be hydrogen sulfide that didn't show on the test? Because of, did you do the Trio Smart test? That'd probably be my first thing to think about. Second would be, could it be, SIBO that doesn't now want to eat lactulose, which is the main substrate we use? And what if you did a fructose substrate test, SIBO test? Would we find something? Because you still have the same symptoms now, except now they're worse. So that's where I'm going with it, is that you still have it, but it didn't show. Now, another option would be it really is gone, SIBO, and you have something else that's going on that was probably always there that now is shining bright in the light. Doesn't quite seem to fit, but it's just something else we would have to put on the list. And then you just have to start going down. We have a differential diagnosis list for you in the course, which means what are all the other diseases that it could be? What else could be wrong if it's not SIBO? You'd have to start working through those. I generally start with a stool test to see if there's parasites or if there's yeast overgrowth. It doesn't always show. Neither of those necessarily always show on a stool test, but that's usually the first place I go.